Good morning, my friend. It's a beautiful day to be alive, and today I want to take you with me on a nature hike as well as talk to you a little bit about my thoughts and research on COVID-19 and what I'm doing to stay healthy. I probably won't go into extreme detail because I don't want to bore you, but I do want to talk to you a little bit about my thoughts, and I also want to hear what you're doing to stay healthy, so make sure you leave me a comment below. Everyone seems to have different thoughts and opinions on this, so I think it's really interesting to discuss. Since everything was closed, I went back to my lab, worked, and researched during the shutdown. But everything opened back up last week, and I was able to go on a really cool gold prospecting adventure. Make sure you check out my last video so you can see all the fun details. I'm really glad I have this truck camper because I'm going to use it to visit as many beautiful destinations as I can, and I don't have to get on crowded transportation like airplanes or airports or visit hotels. I can still adventure and stay safe and socially distance. So I just got to the trail. I've never actually gone on this trail before, so I'm gonna see if I can venture down to lake level. Really excited, the sun's out, the birds are chirping, it's a beautiful day. So as a research pharmacist, I focus a lot of my time on pharmacokinetics and pharmacodynamics, on drugs and naturally occurring chemical compounds that are found in our food. And the purpose of my research is to increase longevity, which basically means living a happier and healthier, longer life. And if you've never heard of those terms and you don't know what they mean, pharmacokinetics is basically the study of how drugs move through the body, and pharmacodynamics is how the body reacts and responds to those drugs through chemical and biological interactions. The relationship between those two terms is pretty complex, but I'm trying to keep this video as simple as possible. Check out this view. So after all the research I've done and all the customers and patients I've talked to, I'll boil it down to one simple principle, and that's this. The best thing that you can do right now, especially in a time like this, is eat a healthy, balanced diet. Stay hydrated, get a sufficient amount of sleep, and exercise frequently. It may seem too simple, but the majority of people just don't do this. We spend billions of dollars and enormous amounts of resources to develop and formulate medications to fix problems that would simply be solved by following these principles. Obviously, there's exceptions to this, as there is to everything, but for the majority of people, this stands true. I had to climb down this sketchy rock wall behind me, but I'm almost down to the lake, so it was an operation success. Okay, so now that you know a little bit more about me, let's talk more about COVID-19 and the things I'm trying to do to stay healthy. SARS-CoV-2, also known as COVID-19, is a SARS virus, which stands for Severe Acute Respiratory Syndrome, and it's similar to other viruses, SARS-CoV-1 and MERS-CoV. SARS-CoV-1 first surfaced back in Asia in 2003. I remember seeing it on the news. It also caused a severe respiratory syndrome, and the same panic ensued. Quarantines were placed and vaccines were quickly put underway. But then, unpredictably, the virus fizzled out, and we forgot about SARS-CoV-1. But then, in 2012, MERS-CoV emerged, but it was primarily isolated to the Middle East. Again, we kind of forgot about it. And now again, SARS-CoV-2 pops up in Asia this year. All three of these viruses are caused by coronavirus. Coronavirus is not a new thing. This type of virus has actually been around for centuries. Some varieties, in fact, actually cause the common cold. However, with SARS-CoV-1 and 2 and MERS-CoV, they were all novel to humans, which means we had absolutely no immunity to them, and they transitioned from animals to humans. So a lot of people ask the question, why can't I just take a drug or a medication to get rid of SARS-CoV-2? And that's because viruses are different than bacteria. There are viral infections and there are bacterial infections. Bacteria are living organisms. They are unicellular, meaning one cell with living functions. Because they are living, they carry out processes necessary for life, and those processes can be targeted by medications. For example, antibiotics attack cell walls, target protein production, and stop replication in the bacterium, essentially killing the bacteria and halting the spread of infection. And because so many bacteria have similar features, such as the proteins in their cell wall, it's easier for one antibiotic to blanket cover many bacteria. This is why medications like penicillin cover so many different types of bacteria. Antibiotics, however, are not effective against viruses because viruses are not living cells and they don't have any of these processes to target. Viruses don't share many similar characteristics. They're always rapidly dividing, mutating, and changing, so targeting them is much more specific and difficult. This is why one antiviral against the herpes simplex virus isn't effective against another virus such as HIV. Viruses don't do any living processes like bacteria do. They have to hijack healthy living cells in order to replicate and cause illness. And in order to hijack a healthy living cell, there are proteins that bind to the proteins on healthy cells. It's kind of like a lock and key mechanism. Once the virus hijacks the healthy cell, it turns it into a virus-producing megafactory, pumping out hundreds of copies of the virus, circulates it throughout the body, and oftentimes it goes undetected. Which is why sometimes you can have hundreds of copies of a virus circulating throughout your body, spreading it to others before even realizing that you're sick. In addition to that, as viruses spread, the stronger viruses become more efficient at replicating. So when we socially distance, we stave off those stronger viruses, weakening all of the viruses collectively. I know it's a lot of information to handle all at once, but to summarize, bacteria are living unicellular organisms. Viruses are not. Bacteria can replicate themselves. Viruses require a host to replicate. Bacteria have a lot of similar functions to target, and viruses do not. Viruses become psycho ninja killers, and they take over our healthy cells and turn us into viral-producing factories. So what happens when we encounter the SARS-CoV-2 virus? In a normal situation where we have some immunity to the virus, our immune system immediately starts to work fighting against the virus, trying to get control over the viral load. But because we have no immunity to the virus, we become more compromised and susceptible to infection. But in certain individuals, which we don't quite understand, their immune systems become overactive and produce something called a cytokine storm. In an ideal world, we would have a vaccine that's effective against SARS-CoV-2. But developing a vaccine can take many months to many years. Developing an effective one would be amazing if we could actually get one in 18 months. That would be record timing because, for example, we've been working on an HIV vaccine for over 20 years. Developing a vaccine basically entails taking a portion of the virus or an inactive form of the virus and presenting it to the immune system so that we're able to develop antibodies against it. That way, if we're ever presented with the virus in real life, our immune system is able to fight against it. Ultimately, I'm hopeful that through social distancing we can lessen the effects of COVID-19. However, because it's such an unpredictable virus, it's hard to say what the outcome will be without a vaccine. I just came across a small cluster of snow plants, which are a wildflower that pops up April through July. And they're called snow plants because they usually bloom right after all the snow melts. Pretty cool, right? So here are some of the things that I'm personally doing to try to stay as healthy as possible in case I do come down with the virus. The first thing I'm doing is ensuring I'm getting a healthy, well-balanced diet. I'm also supplementing with a multivitamin to get all my trace minerals and vitamins. Obviously, the best way to get a well-balanced diet is through proper nutrition. But typically, the average American doesn't get a well-balanced diet. It's full of processed foods, refined grains, and simple sugars. I personally think that a multivitamin is one of the best supplements that I can take. I think of it as an insurance policy. While I may not need everything in it, I'm at least getting all of the essentials that I might be lacking in my diet. If you've ever looked at a multivitamin or nutritional fact panel with vitamins and minerals on it, you'll see a recommended daily value. I've come across a lot of people who have a misunderstanding of this value. Most of the time, it's somebody who doesn't have any background in medicine or nutrition, and they think that if they follow those recommended daily values, that they're getting the most optimal nutrition they need. Unfortunately, that's not always the case. These recommended daily values were created to ensure that the majority of the population doesn't become clinically deficient in critical nutrients and vitamins. When you become clinically deficient in these necessary vitamins, it can lead to diseases like scurvy, which is due to a lack of vitamin C, pernicious anemia, which is due to a lack of vitamin B12, or rickets, which is due to a lack of vitamin D and calcium. You don't hear much about these clinical conditions or diseases much anymore because we've fortified our foods with these vitamins in order to avoid them. But preventing a clinical deficiency is a low threshold in comparison to achieving optimal nutrition. If you're a relatively inactive, stagnant individual, you may not need more than the recommended daily value. But if you're training for marathons and triathlons, you may very well need more. And as we age, our requirements change because our bodies are able to absorb nutrients less efficiently. Basically, what I'm trying to say is that a recommended daily value isn't a one-size-fits-all. If you're trying to achieve optimal nutrition, you should work with a registered dietitian and a physician that specializes in nutrition. And that way they can monitor your diet and blood work to ensure you're getting everything you need, but not too much, because too much of anything can be harmful as well. All of our bodies are different. It's amazing that we live as long as we do. Our bodies and health need care and checkup too, just like our cars. I think it's crazy that we're willing to take our cars in every several thousand miles for an oil change to make sure our engines aren't about to blow up, but we're not willing to go in and get a checkup with our doctor to make sure our bodies aren't about to blow up. A car is completely replaceable, but our bodies are not, so I hope that puts things into perspective. In addition to a multivitamin, I'm also taking 5,000 IU of vitamin D every day. Vitamin D has so many benefits to it, I can't even list them all in this video. And an overwhelming amount of Americans, upwards of 70%, are deficient in vitamin D, especially right now since we've all been stuck inside for so long. I did a simple video in the past covering vitamin D, but I really think I need to do a more in-depth video covering all the science behind its health benefits. I really think that if I could only take one supplement a day, it would definitely be vitamin D. In addition to a multivitamin and vitamin D, I've been exercising frequently. In fact, I've been trying jump roping out a lot because it's a great cardiovascular activity that you can do in place. Not only does exercise release endorphins, creating a natural high, it also helps you stay fit and keep your BMI under control. Maintaining a healthy BMI has always been important, but now more than ever with COVID-19, it's important to keep your weight under control. Severe obesity is defined as a body mass index over 40. And according to the CDC, obesity has increased complications and severity of COVID-19 patients. Obesity can make breathing much more difficult and increases your chances of developing something called ARDS. It also causes difficulties with the doctor's ability to provide respiratory support in critically ill patients. In addition to exercise, I've also been getting a good night's rest. I track my sleep with my Whoop band. The Whoop band is great. It measures all types of data, including the number of hours of sleep I got versus how many I need, my REM cycle, how many disturbances I have throughout the night. It also tracks lots of data when I'm working out, such as strain, heart rate, and calories, as well as recovery. It's really great because it tracks all your progress and how well you're doing with exercise and sleep. In addition to getting lots of sleep and exercise, I'm staying as hydrated as possible. I'm washing my hands, socially distancing, and practicing good hygiene. Harvard's health letter suggests that a healthy individual get 30 to 50 ounces of fluid each day, just not all at once. We're all made of water. It's necessary for every cell's function, so make sure you stay hydrated. Now that things are all opening back up, let me know what your thoughts are. What are you doing to stay healthy? How has this changed your life? And what are you doing to mitigate your risks at catching COVID-19? Thanks so much for watching. Make sure you subscribe so you don't miss my next video. Catch you later.